To seasoned clinical trial professionals, pain scales may seem straightforward, but to the study subject, who is viewing them for the first time, they can be extremely complicated. Therefore, study subjects need to be educated on the appropriate use of protocol-mandated analgesic scales. In order to do this, first we set patient expectations, and then we explain logistics. At Lotus, we understand that before precision, there must be clarity. We have 4 chapters that we use to set expectations. Here is an example. It is a well-known phenomenon that in placebo-controlled clinical trials, subjects that receive placebos generally do show some improvement. In order for any clinical trial to be successful, the people who are assigned active medication have to get a better result than the people who are assigned placebo treatment. And therefore, it's in our benefit to minimize this placebo response as much as we can. It's odd when you think about it that patients who receive placebo would show some improvement. One would logically think a patient receiving a sugar pill would not get any better, but they do. It's not well understood why, but I have 2 theories. One theory is that patients are conditioned to believe the medications they take will prove to be effective based on their past experiences. This is known as the sugar pill effect. So when you take a medication, you think it's going to work, and somehow that makes you feel a little bit better. Another possibility is that the study subjects are just trying to be nice. They want to say something nice to please their doctor and the research staff and be supportive of the study team that's caring for them. So when their physician asks them, "How are you doing?" they tend to say, "I'm doing a little bit better," because they feel this will please their doctor or the study team. After all, the word placebo is Latin for "I will please." But remember, the study team doesn't know whether or not you are getting placebo, and you don't know whether or not you're getting placebo either. In that regard, you're off the hook. Just be as honest as possible about your responses. Don't feel pressured to give a positive response. Just take the time to give an accurate response. This is what's going to give us the best study result. There is no right or wrong answer. We have 5 modules that discuss logistics. Here is one example. Most pain studies require that you give an answer about how much pain you're having on a scale of 0 to 10. The problem with pain is that it is subjective, and everyone experiences pain differently. What we would like to do is have a conversation before the study starts so that we can all agree on what the different degrees of the 0 to 10 scale mean. For the purposes of our study, let's use the following definitions. A 0 out of 10 means that you're having no pain at all. A 10 on the scale means that you're having the worst pain you could possibly imagine. Somewhere between a 0 and 3 is what we categorize as mild pain. Mild pain is annoying. It hurts, but it's not necessarily to a degree that really bothers you or prevents you from doing the things you might want to do. It's not a pain that would automatically make you want to take medication. Moderate pain is somewhere between a 4 and a 6. Moderate pain is the kind of pain that is uncomfortable. When you have moderate pain, you have difficulty concentrating. In other words, you feel the pain and it's hard to ignore. You want to relieve it by taking medication or doing something. It's a pain that bothers you significantly. Severe pain is any pain that's a 7 or above. When you say your pain is the range of 7 to 10, it means that the pain is extremely intense and overwhelming. Severe pain does more than affect your ability to concentrate. It makes it so you can't think about anything else besides the pain. It's a pain that you cannot ignore, and it's the type of pain that would make you anxious. At this point, you definitely want and need medication to relieve it, and are probably thinking, I need some medicine for this pain right now. This is a complete chapter list. For more information on our educational techniques and data that support their efficacy, contact us.